Hello and welcome. I'm Vincent Makori. This is Africa 54. Now, the deadly Ebola virus has reached the United States. Just one day after the first case of Ebola was diagnosed on American soil, medical experts in Texas are scrambling to find out how many people may have been exposed to the dreaded disease. The head of the Centers for Disease Control and Prevention, Dr. Tom Frieden, confirmed Tuesday that the potentially deadly virus was found in a male patient who was infected in Liberia.
This individual left Liberia on the 19th of September, arrived in the U.S. on the 20th of September, had no symptoms when departing Liberia or entering this country, but 4 or 5 days later, around the 24th of September, began to develop symptoms.
Frieden said the unidentified patient was hospitalized last Sunday at Texas Health Presbyterian Hospital in Dallas and is now in strict isolation. Hospital officials are trying to determine who may have come in contact with him.
Well, I can't speak to the people outside of the hospital, but from what we're determining, and we're looking at all the people who might have had contact, there doesn't appear to have been any significant exposure, because only exposure requires exposure to blood or body fluids. And at the time of that visit, he wasn't that ill. He wasn't having body fluids. He wasn't having vomiting or diarrhea.
Dr. Frieden said the CDC was prepared for an Ebola case in the U.S., and there is no doubt authorities will contain the virus. 4 American aid workers who became infected in West Africa have been flown back to the United States for treatment after they became sick and have since recovered. An American doctor who contracted the virus while in Sierra Leone was flown back to the U.S. Sunday and is being treated at federal health facility near Washington, D.C. Ebola has killed nearly 3,100 people and infected more than 6,500 in West Africa. Guinea, Liberia, and Sierra Leone are the most affected countries. The virus causes uncontrollable bleeding, vomiting, and diarrhea. It is spread by direct contact with the body fluids of infected patients. There is no specific treatment, but an American doctor diagnosed with the virus was found to be Ebola-free after taking an experimental drug in August. The Pentagon said Tuesday it is sending 700 U.S. soldiers to Liberia to help that country handle the outbreak. 700 Army engineers will also help build treatment centers. No U.S. military personnel will provide direct care to Ebola patients.